Welcome everyone to today's webinar, Reducing Burnout, Best Practices to Support Clinical Teams. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. First, we will start with a discussion and have time at the end for a Q&A session. If you have any questions, please submit those into that Q&A box you see on your screen. Second, today's session is being recorded and will be made available after the event. You can use that same link you used to log into today's webinar to access that recording. Third, our webinar console also includes a webinar survey. We kindly ask that you take a moment to complete it before we wrap up our session today. And then finally, if at any time you don't see your screen moving or you have trouble with the audio, try refreshing your browser. You can also submit any technical questions into that same Q&A box. We are here to help. With that, I am pleased to introduce our wonderful panelists joining us today. We have Sandy Albright, clinical consultant with Cardinal Health, Ebony Cherry, licensed mental health clinician, EAP consultant at Cardinal Health, and Hope Johnson, vice president of perioperative services with Lehigh Valley Health Network. Sandy, Ebony, Hope, thank you so much for being here today. Let's get started. This is a really important topic, and I want to make sure we have enough time to dive deeper into it. To set the stage a little bit, the prevalence of clinician burnout has risen greatly over the last few years, partly driven by the pandemic, the reliance on contract labor and travel nurses, for instance, and it's increasingly a growing health concern. I'm curious, as we get started here, how do you define burnout, and how have you seen clinician burnout evolve over the past few years? Sandy, can I turn to you first here?
Absolutely. Thank you, Molly, so much for having us present this panel discussion. I am not an expert on clinician burnout. However, I have been a registered nurse for over 40 years and have experienced and witnessed stages of burnout throughout my career. Burnout has been thoroughly studied, and I will present findings from a number of studies during this discussion. In 2019, the Joint Commission recognized the effects of clinician burnout and published this statement. Nurses accomplish a myriad of tasks and responsibilities, but often at high personal cost. The need to juggle competing priorities is often high stress situations can result in feeling overwhelmed or burned out. Burnout is a work-related phenomenon and has been the subject of many studies since the 1970s. I found that the World Health Organization's definition of burnout to be the most comprehensive. WHO classifies burnout as an occupational or work-related phenomenon and defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by three dimensions: feelings of energy, depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. My co-panelist, Ms. Cherry, will expand on the dimensions of burnout. Fundamentally, burnout is an obstacle to professional well-being. Many of the same factors that contribute to burnout in some clinicians may lead to other forms of diminished well-being in others. Well-being is a function of complex interplay of physical, emotional, mental, social, and spiritual factors that interact with the ecosystem within which the person resides. In psychology and related fields, there is no agreement on the number of factors that constitute well-being. Aspects of well-being include physical well-being, economic well-being, social well-being, professional and personal well-being, emotional well-being, psychological well-being, life satisfaction, and engaging activities at work. Healthcare is going and has been undergoing many dramatic changes in technology, regulation, policy, and societal trends. These all have profound effect on those that deliver healthcare, the clinicians. In a report by the National Academies of Sciences, Engineering, and Medicine, their report's titled Taking Action Against Clinician Burnout, their research showed that between 35 and 54% of US nurses and physicians have substantial symptoms of burnout. Similarly, the prevalence of burnout ranges between 45 and 60% for medical students and residents. In 2019, National studies of U.S. physicians use rating scale of burnout, and they they exhibited characteristics in over 40 to 54% of them. The study was performed pre-pandemic. Studies have shown that the younger healthcare workers and those early in their healthcare professional careers are at great risk for burnout. Because of this, the syndrome, as I mentioned before, has been the most studied in medical and nursing professions. The effect of burnout and turnover and productivity have a tremendous economic cost on healthcare organizations and society. A recent estimate of the societal cost of turnover and reduced productivity due to burnout among physicians in the United States was greater than $4 billion annually. The COVID-19 pandemic posed challenges to healthcare delivery, and burnout has gone up as a result. Between September and November 2021, Nurse.org surveyed 1,500 nurses to ascertain the effects of the pandemic on the nursing profession. The study found that nurses are struggling, that only 12% of nurses are happy where they are, and over 80% feel burnt out, underpaid, frustrated with their administrators, and that the past year, 2020-21, had affected their mental health. Similar findings were discovered by the American Nurses Foundation and the American Nurses Association in their COVID-19 impact study. They found 60% of acute care nurses report feeling burnt out, with 75% reporting feeling stressed, frustrated, and exhausted, all characteristics of burnout. Contributing factors include furloughed positions and job loss, unusual shift requirements, changes in job responsibilities where skills are not well matched, short staffing, and increased numbers of travelers and temporary staff. This increased burnout has led to more awareness today. High rates of burnout is a single signal to healthcare leaders and organizations that improvement in the clinical work and learning environment is required and are a national priority. Thanks.
Sandy, so much information shared in
Yes.
the response, the WHO's definition, a really helpful reminder that it is a syndrome, like you said, not a mood. It's not something that, you're having a bad day, you're burnt out. As you said, there's clear definition or dimensions of it. And then also you really helped remind us that this was in effect long before the pandemic. I think sometimes there's recency bias in how people talk about burnout in healthcare. They think it's a causal relationship to the pandemic. As you just illustrated, made it much worse, but it predates it. So thank you so much for setting the stage. That was a lot of valuable information as we dive in here. Hope, let me give you a chance to build on what Sandy shared when we were talking about your definition of burnout and what you've noticed in terms of how it's grown in intensity over the past few years.
Yeah, and I will absolutely agree with Sandy's first statement. I'm, not an expert on burnout, but I think all of us have seen how this has evolved. And I'm glad that she brought those points up, that this isn't something that's brand new, but definitely something that I think in the most, recent past 3 years, we've seen it, and there's been a light shown on it, which is actually probably the silver lining in all of this, because I think there are programs in place and we're seeing this a lot more, but, I think just in my position and seeing how it's evolved just in nursing in general, I think back to something as simple as getting together with your colleagues after work and having a sense of team and togetherness. And I just don't see that. And so I think that, and it's definitely because of this, this epidemic of burnout is, once I'm done at work, I don't want to see anyone else. And so I think that also starts to spiral into things that add more pain to the situation, right? There's not a sense of camaraderie like there was, which exacerbates the issue. There have been a lot of nurses leaving to travel, and I think that they don't have a place to call home. You don't have a culture that is then kind of forged because you have all of these external influences. People come in, they do their job, they go home. And that piece of togetherness and as I said, a culture is missing. And so I definitely have seen that burnout evolve into this, overtime needs more convincing, back there, everyone's tired of doing the overtime, right? It's not fun anymore. It's not, to just, take your family on an extra vacation. At this point, we're all desperate. And I think people are just done and tired of that. So, obviously we've seen that, but I think of those things, the decreased sense of team is probably the thing that is coming out the most, that I've seen this really evolve. But I'm convinced that we can get it back. So, with just having a visual on it and, working hard as teams and administrators and mental health providers and, everyone to help get us out of this.
Thank you so much, Hope. So the reduced presence of teams, it sounds like a contributing factor and also another effect. It's almost a chicken or the egg situation. It contributes to it. And then it's also, like you said, people are more isolated. There's not as much collegiality and team bonding as there once was. Ebony, I'm going to turn to you to talk about other factors that contribute to staffing burnout. And also, if this is a syndrome, like Sandy reminded us, if we are to manage it like a condition, what are some signs to look for in staff and employees so you can better tend to them almost in a preventative way versus it worsening and when it's really an acute problem?
Thank you, Molly. It is truly a pleasure to be a part of this conversation. And as you said, burnout does have many contributing factors. I'm going to focus on 4 of them. The first one is workplace demands that are unmanageable, unrealistic, things like high workload, administrative burden, poorly designed technologies, chronic overtime, excessive on-call burden, being asked to fill more roles than are realistically possible for one person, or given multiple roles without sufficient time or resources to be successful, and also the inability to take breaks or not being able to take time off. Another contributing factor is how much control nurses have or feel that they have. Whether nurses have adequate autonomy and reasonable ability to make choices about the pace of their work, the volume of their work, how their work is managed, and the way that they do their work. Another contributing factor is role confusion, where the role of the nurse is unclear. And this is typically due to rapid, constant change, especially around workplace procedures, responsibilities, and then absence of fairness, not being treated with dignity and with respect. Another example of this is when resources are not allocated fairly, opportunities are allocated with bias. You also asked about the signs of burnout. So I'm going to expand on the 3 burnout dimensions that Sandy mentioned. The first one, exhaustion. Being super tired, physically drained, emotionally drained. Essentially, you give your all, and then you don't have much else to give. The second dimension, cynicism. Being disengaged from the work, disengaged from coworkers, disengaged from clients, patients. Cynicism is also characterized by a negative attitude. Also, the third dimension, a lack of accomplishment or efficacy. This mostly means that you start to doubt that you're doing your job well. Some physical symptoms can be headaches, problems with sleep, mental and emotional symptoms, hopelessness, anxiety. Behaviorally, it can lead to dreading going to work, avoiding work, actively seeking other employment. It's also really important to remember, though, that organizations can reduce burnout and even prevent it, as Hope said. So doing so, though, starts with an assessment of the work environment.
And can you expand on that too, Ebony, when you talk about assessing the work environment? Does it mean looking for some of the contributing risk factors that you first described?
Absolutely. When an organization is trying to figure out how to handle burnout, one challenge is the tendency to focus on, what's wrong with the person or the nurse. How do we fix nurses? How do we help nurses cope? But assessing the environment means first understanding that burnout is an individual's response to conditions that exist in the workplace. So when an organization is assessing the environment, they're asking, like you said, what is contributing to burnout here? Assessing the environment for those experiences that are depleting nurses. Nurses experiencing a sense of isolation. Are they not having enough time to eat when they're at work? Are there inadequate supplies or other resources? Assessing their workload. Are their caseloads too high? Do nurses have time to complete required tasks within the time that they have? Also assessing the type of work. Is it high risk? Is it critical? Are patients' needs emergent or urgent? Also assessing, is a big portion of the work mundane? And also assessing work circumstances, technical, procedural issues, are those getting resolved for nurses? Do nurses have training available to them? Are their roles clear? And then there's also the interpersonal factors that an organization can assess. Assessing, are nurses experiencing micromanaging? Is there a pattern of not listening to nurses? Is there a lack of collaboration? So ongoing assessment of the environment is key in mitigating burnout factors for nurses.
Thank you so much, Ebony. A great overview of contributing factors, symptoms, if you will, and then also what that assessment of the environment should look like and entail. Hope, I'm going to turn to you next. Clinician burnout, clearly a major problem. It impacts both clinicians and their patients. How have you seen burnout not only affect staff, but also the quality of patient care? Can you help us see the bigger picture with how this can come back to affect or harm patients as well?
Yeah, I think, Ebony used that word engagement, and that's huge. And I think that burnout drives a disengagement, as she indicated, which kind of filters down to something as small as, committee work that helps drive patient care, patient quality, whether that's policies or procedures. I think we'd be remiss if we didn't talk about how burnout has led to a mass exodus, and that mass exodus has led to increase, nurse-patient ratios, which kind of further just snowball this effect of exhaustion. And I think, obviously with that, little things can be missed, when you have 8 patients instead of 6. So I think, we know that it affects the quality of the care that's delivered, or even just what a nurse would want to give to their patient, that little bit of exhaustion and, that little bit of disengagement doesn't make you who you are or how you should treat the patients or families. Have shorter fuses, maybe not only with them, but also with precepting, right? You're tired of precepting, you don't want to, well, that's going to help get us out of, of this nursing shortage. And I think, that's another way that we can see that, because you need more nurses there to care for the patients. So I think it just snowballs into many, many different things of things suffering and not being able to, provide the care that we necessarily can or want to on a daily basis.
And that goes back to what Ebony had shared, Hope, about efficacy and feeling as though you aren't providing the level of care or doing the work that is usually up to your standards, your own personal standards too. So thank you for connecting those dots for us. Sandy, I'm going to check in with you next. When we're talking about how burnout can come back to affect patient care, what would you add to what Hope had just shared?
Everything that Hope has shared about what causes or what depletes the quality of care is really so impactful on quality of care. I mean, we know that when people are burnt out, they're exhausted, they don't have professional efficacy, and they just don't, if you will, have their heart in their job to do their job. And so it becomes more, instead of a passion, which what nursing is. I think Hope and I are nurses. I think we went into the profession, I know I did, to care for people and to be passionate about what they need and to meet their needs. And when you're not feeling really good about yourself or getting into those finding you're seeing those dimensions of burnout, the exhaustion and the other dimensions, you just don't have it in you to be as compassionate or work with passion or be present for taking care of doing patient care. So that is one of the things that that I find, just even on a personal level and what I've experienced. Like Hope said, I mean, even our studies show that there were at least 29% of nurses leaving nursing, and that with nursing, it's kind of a catch-22, if you will. Nurses leave, we have a shortage, people are overworked, they have more people to take care of, and therefore all those things start make it more difficult to perform quality care. If we don't have the healthcare providers, then we don't have people to perform quality care. The other thing too about if you're not compassionate and you're tired or you're overworked, you have a high nurse patient load, you become poor communicators. And when patients go home and start filling out surveys, which organizations are attached to reimbursement and referrals and other things that are going to get more patients in the door, patients who don't feel like their caregivers are listening to them or are good communicators are going to rate their hospitals and their hospital experience poorly. So that affects the organization because they're not getting the high scores on patient satisfaction that will make them available for renewing contracts with insurance agents, insurance companies, and getting the people in the door to build the revenue to keep the hospital doors open. So it's so impactful on all aspects of the patient care continuum and quality of care. The other thing, people that are burnout, I also found out that they may make errors more. Again, that a lot of time that has to do with nurse-patient ratio. But then if they're burnt out, they're less likely to report medical errors. They're just don't feel that it's something they need to report. And that can make them more susceptible to litigation and malpractice claims. The other thing that happens with burnout clinicians, they're more likely to patients may be at greater risk of patient care incidents like falls or infections, that if they aren't following procedures as established by the organization and take shortcuts, then there's the established quality of the patient care is diminished. So yes, burnout affects the quality of patient care.
So we've talked about basically from contributing factors, symptoms and signs, how this can come back to affect patients. We talked about assessing the environment. Now I thought we could devote some time to actions and solutions. So once those assessments are completed, what are some of the workplace measures that you have seen leveraged to mitigate burnout? Sandy, can I stay with you with this question?
Absolutely. Clinicians and bedside nurses, they require supplies, that's already been mentioned, to perform their task for their patients. When they spend too much time searching and collecting supplies for these tasks and procedure, adds stress and delays to patient care. Essentially, just basically, They just want the equipment or the supplies to do their job. But if the lack of supplies or not having the correct items and supply rooms that are not stocked lead to increased frustrations. They just want to focus their time on apportioned patient care and have what they need, the supplies and equipment to do so. Having the right resources at the right time ensures efficient processes and contributes to a safe environment of care. When they have to leave the bedside to obtain and search for supplies, they extend patient discomfort, anxiety, and in the perioperative environment, it may extend anesthesia and surgical times. And then patient outcomes could be impacted as a result. Clinicians, because of this discordance, they become stressed and may lead to poor staff and physician satisfaction, morale, and performance. Companies like Cardinal Health, we work with clinicians to develop kits and custom procedure trays to meet their supply needs of specific patient tasks, like IV starts or dressing changes and surgical and invasive procedures. They're developed by collaborating, with clinicians to create the most cost-effective and time-efficient cohort of supplies to meet the needs of the patient care tasks and surgical procedures. These kits and packs decrease the time spent gathering supplies. It boosts productivity and morale while minimizing waste and reducing risk for errors and mispicks. It improves patient, and they ultimately improves patient safety. Using custom pack and kit programs improves the management of surgical supplies and promotes consistency and standardization in care, and sometimes best demonstrated practices are enhanced. When an organization is staffed with travelers and traveling nurses, custom programs or custom kit programs assist in their compliance and department utilization supplies. Cardinal Health will perform periodic pack program reviews to assure that programs and kits are current and relevant to organizational and best demonstrated practice. Consulting with the team of experienced clinical practitioners brings the best demonstrated practices and professional standards to each review. Analytics and benchmarking, part of these reviews, assist in providing the best opportunity for a clinician. These reviews are performed in collaboration with the clinical end user and often include logistical assessments to help identify areas of opportunity for improvement for supply and pack management. All these activities help reduce clinician frustration so that the right supplies are available for the appropriate task at the right time. The other thing that clinicians need to be concerned about is maintaining licensure and professional development. Cardinal Health provides free continuing education courses that can help clinicians meet these certification and licensure and professional development needs. Thank you.
Sandy, I imagine too, with the kits and the packs you described, in addition to saving time, the cognitive burden that can be alleviated if you have to remember to grab or obtain 6 things and they're all ready in that one, that's a lot of decision making and memory save too.
Yes, ma'am. Absolutely.
Thank you, Sandy. Hope, can I turn to you too for workplace measures that you've seen leverage and that have worked to mitigate or to curb burnout?
Yes, as I said, I love to talk about the solutions because I think, you can spend all day talking about, what it is and really what matters is what are you doing about it? And I think I've seen a lot of things, out there that have helped this. Something as simple as Ebony said, kind of assessing that environment, making sure that you have people have eyes on all of the problems versus just how do we fix that nurse from being tired all the time, and just get more nurses. And so, I think looking at something called a stress response team. Stress response teams help where, whether there's an untoward issue or outcome or just overall, I'm feeling this immense amount of stress, EAP is a huge help in that for organizations with that. having directors of caring and compassion for the colleagues that you have, one department dedicated to just how do we pull everything in to make sure that people know that we're here to support you as an organization, and that we're dedicating resources to helping, the problem. I think, focusing on people and their wellness, providing them the opportunities for wellness coaching, health coaches, having wellness dollars associated, right? When we have healthy employees, they can help the patient population and help the organization. And so it behooves us to provide, resources to them to make sure that both their mental health is in check, and their physical health and emotional health, everything is tied together nicely. I think adding mental health days, specifically calling those out to say, hey, we're adding more vacation time to your bucket because we recognize, that this is an issue. Then looking at something as simple as environmental. Do they have a quiet place to go? And in one of my units, and we've seen this work, is creating, they called it a Zen den, but I think you can call it whatever you want, a meditation spot where it's outfitted with aromatherapy and music therapy, and the unit put their heart into this one location that is a safe space that people can go to, if they are in need of to just take a moment. I also think, we talked a lot about the nurse's role confusion and not really having clarity. And I think we need to recognize that it's not only about nursing, it's about all of the caregivers, on the team, and nursing can't do their job without others. And I think we've recognized that as other business greats have come to the table, people have found it easy to go and work in warehousing or manufacturing and not come to the hospital. And so I think we need to recognize, to help everybody, we need to put programs into place that, both not only are competitive comp models, because we have to talk about money at a certain point in time, that there's competitive comp models for them, as well as career progression models to say, here's why you should come here, and just have career pathways for, the non-clinical roles, because those non-clinical roles help the clinical roles immensely, and we really couldn't do our jobs without them. So I think, making sure that they're cared for in there, as well as something as, look at what can help the nurse on that outside, right? We all have competing priorities, and there's things at home that you're going through, and having elder care and child care options, and having, a resource within your organization that can help connect the dots for people where, maybe you have, kids that you need to take care of, but then you also have parents that you need to take care of. And how can we help leverage things within the community to point the caregivers in those directions? Because they're not only a caregiver at work, they're a caregiver at home as well. So I think, I've just seen a ton of things out there, and education too, right? How do we educate nurses on, this is how you can create moments for self-care. This is how you can, just kind of step back from the chaos and kind of feel renewed. We at certain times start meetings with reflections or patient stories to kind of remind us all, why are we in this? Why are we doing this? To add a little bit of a moment. And I think also limiting things, right? Limiting those meetings to 45 minutes, because, I'm sure Ebony and Sandy have it too. This goes beyond the clinical front lines, and it's the administrators too. And when you're going back to back to back, you cannot care for yourself. So I think having those, limits on things, setting boundaries, right? That's how we would explain it to anybody, is setting boundaries. Like I said, I love talking about solutions, because I think that's how we're going to get out of this. And we do that by sharing work with each other and what has worked well for each other. So.
Well, so much creativity in what you just shared, and also a thread that was woven through the majority of your comments was the sense of community too. You described as collegiality, camaraderie that came through in whether it's designing that Zen room, the committees you described. So thank you so much. Some really creative solutions and action items. I wanted to check in with each of you, because some of these solutions are universal. They should probably be stood up and offered no matter what. But I imagine too, in times of high stress, showing up and mitigating burnout might look a little different or require different resources. What can you share about personal or organizational strategies for nurses to help maintain well-being and self-care in times when stress is really high, situations where people are really firing on all cylinders and the risk of exhaustion is even greater? Ebony, can I turn to you for your thoughts on that?
Yes, it's definitely important for nurses to take care of themselves and to have healthy habits, especially during times of high stress. We know that does decrease the risk of burnout. It also in general increases resiliency. So one example would be, focusing on, why the work matters, how it serves others, how your work contributes to something bigger than yourself. Also, being mindful of any negative habits that you're engaging in during those high stress times, making negative comments, maybe about other clinicians, maybe about scheduling, maybe even about patients. And then also checking your inner critic, because during high stress times, the last thing we need is to, be hard on ourselves. Burnout skews our perceptions. So it's okay to know that we're really stressed, know that we're really struggling, but it's not okay to blame ourselves or, be harsh on ourselves during those times. Be willing to challenge your thinking. So instead of, telling yourself, I don't have enough hours in a day, ask yourself, is this a fact or is this, a false perception, and then also trying to incorporate as many moments of mindfulness during those high stress times. It doesn't mean you have to stop what you're doing or get away from the work. Incorporate it during the work, being fully present, really paying attention to what's happening inside of you, what's happening around you. It really can shift your perceptions. It can shift your mood. It can lessen anxiety. And when you find yourself ruminating on the stress, tedious things, frustrating things, or even boring aspects of your work, be curious, invite a beginner's mind. Mindfulness practice can help us do all those things. Also, just making sure that even during high stress times, or especially during high stress times, taking care of your mind and your body in general. Healthy nutrition, staying hydrated, trying to get as much rest. If you can spend time in nature, that's wonderful. If you can't get outside, gazing outside, looking at nature also has a similar effect on our brains and our bodies. Self-compassion, intentionally notice and acknowledge your own value as you're doing your work. Stay connected to positive people at work, outside of work. And then as Hope was saying, add those supports. Ideally, there are supports available in the workplace, perhaps a wellness coach, mental health coach, mental health counselor or therapist. So seeking those out, not just during high stress times, but always, because sometimes the high stress work, when we're overworking, it can be an avoidance of some difficult things in our personal lives. And so seeking out those professionals can help us be more aware of that and mitigate that. Reaching out to EAP for support during the workday. Learning as much as you can about what's available. All of those supports that your organization have available to you. Take advantage of them sooner rather than later.
Ebony, such a great list of different solutions, especially for those high stress situations, but also, like you said, so many that every day we should be accessing and putting to use. Hope, is there anything you love solutions, you love finding ways to diminish the effects of burnout on a team? Is there anything you would add to what Ebony just shared?
No, I mean, I can't stress enough the making sure that you are, recognizing, understanding, what your organization has as a nurse, and not being afraid to reach out and kind of get, that there are people there that want to listen and can help talk you through that. And I am so glad that Ebony said, not even just during the times of high stress, set a baseline, develop a relationship with somebody, because so often it's you just, want to talk to somebody, and I think they're there. So I definitely think that health coaches, wellness coaches, they definitely can help get you through those rough patches, as well as kind of keep you at a nice, a sustainable just being. So.
And Sandy, I'll check in with you before we turn to Q&A. Anything you would want to add to when we're talking about solutions for high stress situations?
The one thing, first of all, I have to comment on the Zen Den. I mean, I think I'm going to have one of those at home, because that just sounds just so marvelous. But the one thing I wanted to comment on here with this strategies is that, like I said, burnout has been studied a lot, but it's also been recognized by professional nursing associations such as AORN, which is the Association of Perioperative Registered Nurses, and the American Nurses Credentialing Center. They both published position statements and have put emphasis on well-being to help reduce burnout. In 2020, the ANCC added well-being as a sixth standard to their Pathway to Excellence program. And the Pathway to Excellence program is a recognition to healthcare organizations that they've had a commitment to creating a positive work environment that empowers their staff and engages their staff. So when they meet all those standards and they have to demonstrate it, then they get that recognition from the ANCC. In 2021, AORN, the Association of Perioperative Registered Nurses, published their position statement on a healthy perioperative practice environment. They identified the elements of healthy perioperative work environment. Their rationale, as stated, is a positive practice environment encourages safe patient care practices, promotes optimal patient outcomes, and creates a desirable workplace. One of the elements of healthy practice environments promotes resilience and well-being of all perioperative team members, which has been defined as a factor in preventing clinician burnout. Other elements included prioritizing workplace safety, having zero tolerance policy for incivility, value of diversity, equality, and inclusion, recognizing value of nurses' contributions, promoting shared decision-making, and fostering a communication-rich culture. So those are what we see on the national level for our professional associations.
I want to thank each of you. That concludes the presentation discussion of our webinar today. So much valuable information shared by each of you on different tenets of this really thorny problem. Attendees, we are now going to turn to the Q&A portion of the program. If you have any questions for our speakers today, please submit them into that Q&A box you see on your screen. And let's get started with our first question. Sandy, I'm going to stay with you for this first one, but the question is this. Staffing is a top priority in healthcare right now. Can you share some ideas to keep people engaged in the healthcare organization they are working in, i.e. retaining talent and avoiding travelers?
Well, I have some bullet points that kind of guide organizations into creating the environments that keep people engaged. They need to create and maintain a healthy work environment using staffing patterns that reduce reliance on overtime and on-call hours. Develop a predictive staffing model based on both historical and future trending data. Foster a culture of mutual respect and engagement. Support professional development and continuing education opportunities. Develop a no blaming culture. Allocate resources for adequate training, orientation, and onboarding of new staff, and support strategies that promote self-resiliency. I was in a hospital recently that displayed a poster that staff and anybody walking down the hall could see with the words on it that said, "You are resilient." It was to remind the staff of their ability to weather the storm of daily life. I would also add creating a supportive environment for clinician mental and self-care, remembering that self-care is not selfish. So clinicians feel free to maintain their well-being.
Thank you, Sandy. Hope, is there anything you add? We're talking now about engagement and supporting engagement, avoiding turnover with staffing, so relevant universally for organizations. Anything like this example Sandy shared that you would want to make sure our listeners are aware of?
Yeah, I mean, I think recognizing what makes, people tick, right? It's everybody is coming from a different, whether it's a different time in their life, a different, they're needing flexibility. And I think we hear that over and over again. So I think if we continue to run it like we've always run it, we're going to be behind. And I think getting very creative. Some part of me says if you can't beat them, join them, right? Mirror travel programs. That's what they want. What makes that attractive? And so how can you kind of adapt that to work for the organization, and making changes to your staffing. I agree with Sandy 100%, make them based off trends and historic data. You have to make them manageable, your staffing patterns. But looking at how can we make sure that we are in line and being competitive with not only pay and benefits and all of those things. But I think it's also on the flip side is recognizing, the staff, whether that's through, national awards like the Daisy Award programs, or you can have homegrown, award programs that recognize contributions, because, we are always watching and you do want people to be recognized for the jobs that they're doing. And I think that's meaningful. And once you have that, you develop that culture and then people want to stay. They're not going to go anywhere. So I would just add those things as well.
Thank you so much. That was our first question. Let's turn to our second now. And Hope, I'll stay with you if you don't mind for this next one. How are you recruiting graduating nurses and encouraging them to join your healthcare organization? Having a hard time with that word today, despite a rise in travelers and growing burnout. So we're talking about recruiting graduating nurses and encouraging them to join Lehigh.
Yeah, right. I mean, they are a hot commodity. And unfortunately, we're pretty saturated in the area that I am. There's a lot of choice for people for graduate nurses. We also have a lot of colleges, which is great. And I think developing relationships, keeping relationships with those colleges early is great. Leveraging your magnet status, and which we do, and, in my particular organization. But I think it's making sure that people, even at, in college, in nursing school, know what that means and why that's so important. Providing shadowing experience and extern experiences. Hey, why don't you test this out before you commit to something? I think that's great. And I think there's a lot of programs out there. Sandy's referenced AORN quite a bit, and my background is peri-op, and I think it's the one location that nurses don't think they can go into right away, and trying to change that. So welcoming them into that. Having a nurse residency, I think, is also something for us personally that sets us apart. But that's a really important how we're going to, help you and support you along this journey, into that first year, that you're a registered nurse. And that's important. We don't just let you go, right? Somebody's with you and we're there and cultivating that. Again, providing flexibility for the GNs as well, because a GN isn't just a 22-year-old, kid, if you will, right? There, you have all sorts of GNs. And again, where people are in their life, is it a second career for someone? And then I think also for us, it's starting at the college to say, what can we do to help you from a monetary standpoint, kind of reduce that financial burden, because nursing school is expensive. And so how can we help you make that not the fear or the hump that you're trying to get over, in exchange for, coming, shadowing, and having those opportunities, and then, providing that place to work. So I think, again, we're all after the same thing, but those are, I think, a couple, some strategies that organizations, all over are using to kind of get that commodity.
Hitting different levers further upstream and further downstream. It's great. Thank you, Hope. Let's see, our final question for the time we have today. We see so many travelers in the workplace. Are they affected by burnout? Sandy, I'll turn to you first for your initial thoughts here.
Yeah, they sure are affected by burnout, but some people go and take traveling positions to alleviate their burnout. We talked about changing positions, leaving a job to go someplace else, but they may unknowingly step back into similar situations that really drove them to leave their first position. The nurse.org survey I referred to earlier in this discussion found that travel nurses reported higher levels of struggle than staff and per diem nurses. So yes, they are very much affected by burnout for all the reasons we've identified in this discussion.
Hope, is there anything you would add about how you've seen this play out on the ground with travel nurses?
I mean, I agree with Sandy, they're not immune to it, right? Just because they could potentially go somewhere else every 13 weeks, but, culture is a killer for, places. And I don't care if you're there just visiting for 12 hours for your shift or you live there permanently. I mean, I think the burnout can hit them just as much, and I think they're starting to see moving around, so often that hurts you. You never feel like you belong somewhere. And I think that self-doubt starts kind of creeping in, and then it's, what am I doing? Why am I doing this? I'm not satisfied by this anymore. Some people just want a sense of belonging. And I think, and travelers do extra just like our nurses do, right? They're not immune to the overtime. If they want it, they can get it. So yeah, I agree. I think you have to watch them, and unfortunately you probably want to watch them even closer because they don't have maybe access to the same resources. Travel companies don't have, stress response teams, and travel companies don't have directors of caring and compassion, at least none that I've run across. And so I think, you might want to, as an organization, just keep an eye on them. While they're not your employees, they are caring for your patients. And so you definitely want them to be as healthy as the staff that you have. So no, they definitely are not immune.
That is all the time we have for today. I want to thank you, Sandy, Ebony, and Hope, for just an excellent discussion. And I also want to thank Cardinal Health for sponsoring today's webinar. To learn more about the content that was presented today, please check out that resources section on your webinar console, attendees, and fill out that post-webinar survey, if you will. We want to thank you for joining us today. And on behalf of Becker's, we hope you have a wonderful afternoon.